Today's question is, Doctors of Reddit, what is the weirdest thing a patient wouldn't admit?
Had a patient refused to admit he swallowed a pin, even though an x-ray showed the pin in his small bowel and we took the pin out during an emergency surgery. Nurse here. Had parents bring their 3-year-old son to the emergency department for 1 month of abdominal pain that kept getting worse. I asked all the routine questions for this complaint, lots of questions about his poop. Is it bloody? Diarrhea? Mucus? When was his last bowel movement? Any changes in the stool? They deny any other concerning symptoms but abdominal pain. We do blood work, ultrasound, x-ray. Everything comes back completely normal, but the kid is intermittently screaming in pain, curled in a ball. Over the next 5 hours, I continue to repeat the same questions. I asked repeatedly if there was anything else going on that they could think of. Nope. The kid just doesn't seem well, but we have no reason to keep him. We decide to watch him a little longer, let him eat. The kid eats a bunch, a PBJ, apple juice, crackers, popsicle. No pain, so we decide to send them home. I bring in the discharge paperwork and I'm about to start going over instructions and dad goes, for the past 3 months he's had a lot of worms in his poop. Worms. Fucking worms. You spent 6+ hours denying worms. I literally just turned around and walked out of the room without saying a word. I was laughing almost to the point of tears. Could not wait to tell my resident. Deworming medications, a shitload of wasted time, and they were on their way. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. Hey buddy, you okay in there? Sink on full blast. Yep. Everything's fine. I go back to his room a few minutes later, and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy, are you sure this is urine in this cup? Yeah, my pee is always clear. Point is wheeled off the x-ray. I checked the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie, you gotta do better than that. I guess it's not super weird that this patient wouldn't admit this, but it's weird in the sense that it was super obvious what happened, so he might as well just admit it. I used to do patient registration in the ER. 2 of us were wheeling around our computers and registering patients off of ambulances and getting patient information in rooms. A middle-aged guy comes in on an ambulance and my coworker takes it. So I'm finishing up some paperwork and I go to our front office and pull up the patient tracker board so I can see what still needs to be done, and a new patient pops up on the board. Chief complaint. Eyeliner pins stuck in penis. My coworker walks into the office looking scarred. She explained. The nurse asked him what happened and he said he slipped. She told him that doesn't seem likely. So he said he had an itch and thought it would help. We later found out from the nurse that he finally admitted that he saw it on TV and thought it would feel good. His 20-something-year-old daughter was with him, but she clearly had some form of developmental disability. It was all around a sad situation, and I hope someone told him about sounding, and he did some research on safe practices for kinks/fetishes. Apparently, they were both lodged in there pretty badly. That she could actually see. We had this lady that came into the ER at least once per month, usually cheap pain. She was 30s, morbidly obese. She had seen multiple specialists, had her heart/lungs/GI system examined in almost every conceivable way. One night, she comes in with sudden onset blindness. Not her first time with this complaint either. Last time, she got a trip to the retina specialist. When I examine her, I walk around her bed, and she tells her friend to get her feet off the chair so I can get by. She plays it off super cool by adding, "If you have your feet up like you always do." Then the neuro exam. I have her touch her nose, then touch my finger. Her idea of how a blind person would perform this exam is to touch her nose, then wobble her hand from side to side as she touched the end of my finger. Not to mention the near constant eye contact as we talked. I would ask a question and start moving while she talked, and she would follow my eye perfectly. She was extremely relieved to find out she had conversion disorder and that her sight would be back soon. Edit. Maybe it was factidus disorder. I tend to believe all her chest pains and crazy complaints were real feelings she was having due to a number of her social/psych issues. In the ER at midnight, it's a lot easier to tell her it is a symptom of dealing with whatever social drama was happening in her life, and that her eyes worked fine instead of telling her she was lying to me for some gain. Either way, she was sick and needed reassurance. She was genuinely relieved, though. On the finger-to-nose test, she touched my finger on the first try, but instead of a straight line, she moved her hand back and forth about the 3 inches the whole way there, but directly there. My finger was probably 2 feet in front of her face. This happened when I was still in med school. One time I was doing my gynecology rotations. My doctor and I encountered a 37-year-old female accompanied by her husband complaining of lower abdominal pain. After having a look at it, the cause was pretty obvious. There was a fist-sized bruise on her left ischial spine, the rim of her hip, and from the looks of it, black, deep blue, and a dark brown diffusely spread out. It was pretty fresh, not older than a day or 2. I had a literal brain spasm and was about to accuse the husband of domestic abuse when my eyes met with my doctor's. Instantly, I knew she was more qualified to handle the situation than I was, and I decided to keep my mouth shut. She proceeded to examine the area and asking basic questions while carefully palpating the area. She then asked her patient to undress so that she could do an overall assessment and to get a better picture of what she was dealing with. After some initial reluctance from the wife, her husband managed to convince her that it was in her best interest to let the doctor examine everything. My jaw dropped. There were bruises all over her upper abdomen, stomach, back, inner thighs, and buttocks. Her breasts were practically lumps of red inflamed tissue with blotches of bluish black. Every part of her body that could be covered with clothes was covered in bruises in different stages of healing. I have seen my fair share of gruesome things in my life as a doctor, but this one image has stuck with me simply because the women had looked perfectly normal and healthy. My doctor was also noticeably disturbed by what she saw and asked as to how she managed to injure herself. To my astonishment, the women claimed she slipped from the stairs and fell down a flight of stairs and hit herself on the handrail. This woman had tracks along her back which were definitely inflicted by a belt of sorts. And even after a good 20 minutes of going over most of her injuries, she wasn't ready to claim otherwise. Meanwhile, her husband grew more and more restless, and there was a worried look on his face. The doctor then asked both me and the husband to leave as she needed to do a gynecological examination, and she needed to do it alone with the patient. If you ever did your rotations in med school, you know that doctors almost never ask students to leave as we somewhat become a part of the ambience. Always there and learning. I instantly realized she needed to establish trust with the patient one-on-one and needed the patient to be comfortable. I head out along with the husband, and we both stood on opposing ends of the corridor. The husband, now visually disturbed, seemed to want to talk to me. I thought to myself, serves him right? And a whole lot of profanity. After about 5 minutes of awkward silence, he finally decides to move closer to me and says, "Hey, can I speak with you for a minute?" I am now obviously angry and the guy and throw a quick, "What?" glance at him. "Can I say something to you that you can pass along to the doctor? I want to tell you what really happened. I just want wife to be healthy." Now he had my attention. He proceeded to tell me about their marriage of 11 years and how happy they were until about 6 months ago. He told me that she had taken a liking to BDSM and had been increasingly asking him to inflict pain on her in various ways. When he was outright against it, she would insult him and his parents and call everything he held dear whatnot, sometimes for days at end, until he literally couldn't put up with it and gave in to her demands. About 2 months ago, When he said he wanted a divorce as he was done with all her bullshit, she showed him pictures of her bruises on her phone and threatened to sue him for domestic violence and send him to jail. She had effectively trapped him. But last night was worse than every other time. She apparently forced him to punch her multiple times over and over until she almost passed out. He asked for what we could do to help her heal. I looked into his eyes. He was crying where he stood. I went in and pulled my doctor aside and told her the entire story, and they did an ultrasound and found out that she had a reputed ovarian cyst and that she needed emergency surgery and underwent an oophorectomy, and the couple were referred to a psychiatrist and a couples therapist. I don't know what happened to them after that, but I sure hope the guy got out of that toxic relationship. TLDR, BDSM fetish wife traps and forces husband to hit her, ruptures her ovary, undergoes surgery and has it removed. Not a doctor, but I worked in an animal hospital for a while. We had a dog come in terrible shape, vomiting, glass eyes, crying profusely, convulsing, lethargic as fuck, and could barely stand up and let alone walk on his own. Broke my heart to see as I was in the room with the vet. The owners swear that they had no idea what was wrong. Said the dog had been inside for most of the day and that they didn't think it had gotten into anything that could cause it to be so sick. We ended up keeping the dog to further watch it and monitor its condition. One doctor thought it could be acute marijuana toxicity or something along the lines of that, from eating weed or a brownie or something. Had good reason to believe it because the owners reeked of pot and were both high as a fucking kite. However, when asked, both insisted they have never used pot and that there was no way the dog could have ingested any. Because we weren't sure of what was happening, we placed the dog in quarantine in case it was something contagious that could spread to other dogs in the hospital. And when we did that, we had to completely disinfect the room. I went in to start cleaning it, wiping down counters, walls, instruments, etc. As soon as I start sweeping, I notice something on the ground. Lean down to take a closer look, thinking it's just a turd or something. But what did it end up being? A little nug of the electric lettuce. I immediately told one of the vet techs who called the owners. They got super nervous after asking if they were sure that the dog didn't ingest anything and hung up almost immediately after being asked. Seeing as we weren't sure though still, we couldn't treat the dog for marijuana toxicity. 2 other doctors tried calling and nicely asking with the same result as the vet tech. Finally, my favorite and super sassy vet called and tore them a new one, basically saying they needed to own up to it if the dog accidentally ingested the weed, or else they may not ended up having a dog to pick up from the hospital in a few days. That was the point where they decided to mention that a quarter of their freshly baked pot brownies were missing. I was off shortly after this happened, so I don't know exactly what they ended up doing. But as far as I know, the pupper ended up surviving and recovering a day or 2 later. Sweetest dog too. Even in the terrible shape he came into the hospital in, he loved everyone. Those owners almost lost their dog because they were too afraid to admit they smoke weed. TLDR. Super sick dogs with dumbass owners who didn't think they should have mentioned that their dog had eaten a metric fuckton of pot brownies. Woman brought in by ambulance with a first epileptic seizure had been suffering from abdominal pain and vomiting since this morning. Noticed a very obvious tremor. Checked her file and noticed she already had an alcoholic pancreatitis twice before. Long story short, suffering from a 3rd alcoholic pancreatitis, too sick to keep drinking and had a withdrawal seizure. Yet when I asked her, she straight up refused to admit drinking alcohol on a regular basis. The weirdest. A 10-year-old boy is brought in by ambulance with a small stab wound to the front of his right upper leg. Upon inspection, however, there is a blood-stained gap in his trousers on the left backside while still intact where the wound was. Mother said he was at a playground. Kid claims he went into the bushes to pee and stabbed himself on a branch. When asking if anyone removed his pants, he straight up denied it. I asked the mother, and she said he was wearing his pants when he came out of the bushes and the paramedics didn't remove them. When removing his pants, the wound seemed way too linear and clean to be inflicted by a branch. I wanted to contact our forensic department. They do more than just dead people, to come and take a look at the wound, but my supervisor dismissed the idea and obligated me to simply clean the wound and suture him up. I never found out what actually happened. Not a doctor, but 2/3 of my grandmoms were nurses, and they shared some stories. Like a funny one and a sad one. A kid came in one day with mononucleosis and didn't want to admit in front of his parents of kissing a girl. So, reluctantly, half an hour later, alone with the doctor, he comes out, the doctor after him. His mother worried because she doesn't know what's wrong, and he goes up to her. AMD says in the kindest voice possible, "I'm sorry, Mom. I thought it didn't count because it was under the table, so you didn't have to know." One day, 3 patients came in, M20/F22/M50, and the girl was pregnant. M50 insisted that his son told him he still hadn't slept with her, so he couldn't have been the father. They go in, and soon after, father and son leave the doctor's office, leaving the girl inside alone with the doctor. They talked for some time, and at some point the doctor called the police. The patient told her she was raped by the young boy. They came and arrested him, but once the DNA results came back, it showed no connection to him, but it was someone of close DNA with the victim. They arrested her father, and the girl confessed to everything. Lied about my broken hand. It happened in a fight. The doctor had a student with him. The conversation goes something like this: "Doc, so it looks like you have a fracture." Me: "Oh shit, it's definitely not a sprain." Doc: "Nope, definite fracture." Me: "I wish I came sooner." Doc: "Absolutely, it's after setting wrong and we need to break it again so it can be set right." Me: "Well, shit." Doc: "How did it happen?" Me: "I banged it when I fell. I got in a fight." Doc turns to his student: "We call this a boxer's fracture. It's funny because people always lie about it." Me: going red: "Huh, really wouldn't know much about boxing." Doc: "I suppose you don't. Otherwise your hand wouldn't be broken." Me: "Okay, fine. Leave it be. You got your point across." Not a doctor, but a lifeguard. Fairly standard patrol the one day, with relatively small surf conditions. A lady, perhaps in her 50s, comes running up to our team in an absolutely hysterical manner and explains to us that she has lost her grandchild that she was meant to be watching. After trying to calm her down and get a description, we start to look for this young girl. For over half an hour, we had almost all of the team scouring the beach looking for this little girl. We were on the beach, in the water, and all of the surrounding shops. It got to the point where we had made multiple public announcements and had even requested for police to come and assist us. Eventually, a member of our team makes it to the next beach over, about 800 m away by around the corner. And it turns out the young girl is there and has been there with the rest of her family the entire time. Turns out the grandma was just lost and didn't want to admit it. Well, I have a funny story where I told the truth, but no one believed me. I was 14 and was trying to fix my watch with super glue, the kind that gets hard when exposed to air. The little pack I was using was already half used, so the glue was dry on top. To get it out, I flicked it a good 2 or 3 times. The third time it fucking blew and splattered everywhere and got into my eye. Thank God it didn't get on my iris. So I got up like that, rinsed it with water. Nothing happened. So I ignored it and went to my tutor's house for studying. My tutor notices my eye is profusely leaking. He calls my mom and dad and they take me to the doctor. Now I tell them everything as it happened exactly because I tend to do mischievous things, and also this was an accident. The doctor and my parents won't believe me. I am an above average kid. I am not that retarded to squeeze super glue in my own eye. I showed them the watch for evidence and how it was glued up. To this day, my mom and dad bring it up from time to time, tell me that I deliberately hurt myself because it's fun. Anesthesiologists, so I have a few that come to mind. One patient kept getting respiratory depression in his room by himself. He was an amputee, so limited mobility, and he didn't get a lot of visitors. He would go outside to smoke and come back and fine. He denied taking anything. Searches of Helly's room turned up nothing. It was a ward mystery until someone picked up his prosthesis and heard a rattle. He had hollowed it out and had a large drug stash inside. The worst two were people who wouldn't admit things to their family and wouldn't let us disclose things. One was a guy with AIDS admitted with pneumocystis pneumonia and basically no immune system. Every day the family would ask what was taking so long to get better and why weren't we doing anything. Just had to smile and nod. The other was a lady whose husband got deployed, and about 4 weeks later she got pregnant. Told the family that it was the hubby's and gave a due date 6 weeks before her actual one. So the family is giving the obstetrician the gears and threatening to sue because they have let her go until 46 weeks without inducing her. So the whole labor floor had to play along with it when she came in at 47 weeks, and the family were complete pricks. Good times. And this is the end of today's video. I hope you liked it. And don't forget to comment an anecdote or experience similar to the topic of the video. Leave your like, share if you like the video, and lastly, don't forget to activate the little bell so you don't miss any of our daily videos. Bye-bye.